Lascahir. Minister, you're very welcome to the House today, and it's always really good and positive to talk about how best we move forward in this country, looking after people with dementia and indeed brain health. And Senator Hoy really outlined, that briefing we had yesterday, and how positive it was, and how enlightening it was, and it really was something I learned so much at it, and it brought me to a different point of view on how I care for my own health, my parents' health, and my partner's health. So it was really enlightening. I want to thank you for that. And I also, I want to acknowledge the work you have done, Minister, since you came into this office. And I want to acknowledge again my colleague Fiona Loughlin on her work as chair of the cross-party Oireachtas group on dementia and Alzheimer's, and as a member it has been a pleasure to work with you and also all the members of that cross-party group and the Alzheimer's Association. And I also, Minister, as the previous chair of that committee, and what best ministerial post you could have after working so hard on that committee, and bringing forward proposals you had at that committee into your minister and following through on them. As Senator Ronan Mullen spoke so passionately and kindly and almost delicately about his experience and caring for his father with Alzheimer's. And Alzheimer's and dementia, that diagnosis can be so frightening, and so frightening to an individual and the family, wondering how are we going to do this? How are we going to give them the life that they deserve? How are we going to match all life's struggles and all life's challenges and life needs around this new diagnosis? And the thing about what came out from yesterday was that there is so much hope. And it was so positive, it was so empowering yesterday, outlining what we can do to prevent it, what we can do to help, and what is happening in the area of research to make those outcomes better in the future. And as I said, Alzheimer's and dementia affects so many families, all communities, and I want to acknowledge that there are 64,000 people in Ireland currently living with dementia, and the numbers are to rise to 150,000 by 2050. And I also want to acknowledge today the carers, the family carers, who are often women, and after having statements for International Women's Day, we do want to acknowledge that most family carers in this country, and indeed home carers in this country, are women. And we all support advancing the rights of carers and protection and the support we give carers in this country. And something that came so strong over yesterday was that 40% of dementia could be preventable. And by addressing the early risk factors such as hearing loss, high blood pressure, diabetes, smoking and depression, then there are interventions that can reverse this cognitive decline through education, exercise, stimulation and social engagement. And further to this, there are a suite of new significant medical treatments that are coming available, and to slow down that early onset. And addressing yesterday our Oireachtas members yesterday, there was a consultant physician geriatric in stroke medicine at Tallaght Hospital, Professor Sean Kennelly, and he quoted as, "Dementia is the most significant health condition globally for which we have no definitive treatments. But we are now at the cusp of a new era of better interventions to prevent, diagnose, to treat Alzheimer's disease and other dementias. It is imperative that we educate people so they understand what a brain-healthy lifestyle is, and to take action to reduce its risks." And amongst all the struggles and all the very real difficulties and challenges we have for people who have dementia and Alzheimer's, there was such optimism yesterday about working on the brain health. And I really welcome, Minister, your work on that brain health awareness, and the new group, the working group convened by the National Dementia Office and the HSE Health and Wellbeing will run a Brain Health Awareness Month in March, and will collate important information on brain health from all the public attitude survey on dementia. In addition, the Brain Health Project Manager will commence in 2022, supporting the delivery of those actions from the group, and support national campaigns and programmes to incorporate dementia risk reduction. So I think There is so much work to do, work done. I congratulate you on all the extra funding, the 11 new dementia advisors you have. My apologies. There's so much I want to speak on this, but I want to just to acknowledge the work you have done, the work the Alzheimer's Association have done, and all the people within the entire nation who are working really, really hard, and the family carers, and indeed the patients with dementia who are really, really up in their own marks and making their own brain health better every single day. So, girl, my gosh.
So